Hello everyone, myself Dr. Deepakkumar Gupta, Senior Consultant Gastroenterologist at Apollo Hospital, Navi, Mumbai. Today we will be discussing about post-COVID GI manifestation. As we all know, our country is having a COVID pandemic going on since last 2 years. Patients of COVID have various symptoms, and post-COVID the patient will come to your OPD as a recovery in different symptoms in format. The most common symptoms are respiratory symptoms. However, GI symptoms also can come in those patients. As we all know, the COVID virus binds to the ACE inhibitors of the respiratory tract. It also involves the GI tract, the ACE inhibitors, and that's the reason you can have GI complaints in these patients also. Post-COVID GI manifestation mainly comes with loss of appetite, nausea, bloating, belching, abdominal pain or discomfort, loose motions, or even altered bowel habits in the form of constipations. Patients with pre-existing GI complaints or in the form of IBS can have worsening of their symptoms. Patients having pre-existing functional GI disorders like dyspepsia can also have worsening of the underlying GI complaints. Also, other organ involvement of the GI tract like liver can also be involved in patients with post-COVID, where you have to manage and monitor the liver function test regularly. Patients can have sometimes in post-COVID weeks recovery phase severe abdominal pain or even blood in stools. This has to be evaluated by your gastroenterologist in the form of looking for any blood thrombus in the mesenteric vessels or any ulcers in the stomach or intestines, which can be due to the blood thinners being used during post-COVID patients. However, these patients has to be followed with a gastroenterologist for proper medications. However, there are some tips which can be managed at home in these patients, like a proper diet. You should have a well-balanced, nutritious diet involving all multivitamins and protein adequately. You can have zinc supplements in these patients, and vitamin C can be added in these patients also to reduce the symptoms in severity. The patient can use natural probiotics like curd, yogurt can be used in these patients to reduce the symptoms of bloating, dyspepsia. Patient can be approached to a gastroenterologist for use of medications which can be used under supervision only, like proton pump inhibitors, antacids, which can be used to decrease the bloating, belching and nausea symptoms. Patients having loose motions can be treated with oral probiotics or antimotility agents depending on the gastroenterologist's choice. Patient has to be thoroughly examined in these patients to look for any other alarming features. The tips you should be measured in these patients: have a good nutritious diet, have proper exercise. Post-COVID, you should have in the recovery phase, proper exercise in the form of walking is enough for GI complaints, and patients should have proper follow up with the doctor in the OPDs if the symptoms worsens. Thank you.